My name is Mohammed Al-Kouli. I'm an interventional cardiologist at West Virginia University Heart and Vascular Institute and a prior graduate of the Mayo Clinic Structural Heart Disease Program. I am pleased on behalf of my co-author to present to you our work on the effect of race on the incidence of aortic stenosis and outcomes of aortic valve replacement in the United States. This paper will appear in Mayo Proceedings in May, and the first author is Dr. Fahad Al-Qahtani. He's a second-year cardiology fellow at West Virginia University. The takeaway message of the article is that African American patients undergo aortic valve replacement much less frequently than their Caucasian counterparts. And we found that the mechanism for this disparity is multifactorial, driven by both a true disparity in the delivery of healthcare to these patients, but also by the lower incidence of severe aortic stenosis in this population. We also found that once they get into aortic valve replacement, their adjusted morbidity and mortality of the surgery is similar to their Caucasian counterparts. So to address the question of racial disparity in aortic valve stenosis, we utilized the national database called the National Inpatient Sample. We included almost 100,000 patients who underwent isolated valve replacement in the United States between 2003 and 2014. We found the following. One, we found that patients who are of African American race are much less likely to be admitted with the principal diagnosis of severe aortic stenosis than their Caucasian counterpart. And then we calculated the ratio of aortic valve replacement to the ratio of aortic valve-related admissions in both races. And we found that African American patients are still less likely to undergo aortic valve replacement, even if we index that to the number of their admissions with aortic valve disease. So the conclusion from these two findings is that it is true there is a racial disparity related to aortic valve stenosis between African American and Caucasian patients, but it is multifactorial, and it's partially related to the less incidence of aortic stenosis in this patient, but also in true healthcare delivery disparity as well. Once they get through the system and they undergo the operation, surgical aortic valve replacement, the major morbidity and mortality of the operation appears to be similar if we adjust it to socioeconomic and clinical risk factors and hospital characteristics. African American patients did have longer hospitalization and higher cost, but the morbidity and mortality was essentially similar. This study confirms the existence of a true racial disparity in the incidence and treatment of severe aortic stenosis in the United States. It also highlights the need for further research to understand the underlying mechanism in the development of aortic stenosis and the need for effective strategies to minimize these disparities.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.